Everybody. Welcome to 2021. Good riddance to 2020. So glad that year is over. What a rough year. We are here for a fresh start. This is our first town hall of the year 2021, your COVID-19 communityresources.com town hall meeting powered by the Center for Closing the Health Gap. Well, you know, a few million Americans already have received the first dose of the COVID-19 vaccine, and President-elect Joe Biden has promised us 100 million vaccines in his first 100 days. So we want to see how that goes. We want to see when you can get yours. Do you even want yours? I hope you do. So we've got a lot to talk about. I'm Councilmember Jan-Michele Kearney, and moderating with me will be superstar Tropikana from Radio 1. She is on the way. She's going to join us in just a second. First of all, let's give a shout out to our producers and tech team, John Reichel, Lauren Harden, and Sloan Harris. They make it all happen. As a reminder, we are recording this session. We will post it on COVID-19 communityresources.com website a little bit later, so that in case you missed a part or you'd like to see it again, or you have a friend who missed it, they can take a look. To all our attendees, please feel free to start putting your questions. If you're on Zoom, put them in the Q&A. If you're on the Center for Closing the Health Gaps Facebook Live page, please put your questions in the chat. So let me introduce, we've got a great panel. Oh my goodness, these experts. So we've got a lot of questions for them and we're going to get answers. Okay, right. So we have Dr. Odell Owens, President and CEO of Interact for Health, Dr. Melba Moore, our Cincinnati Health Commissioner, Dr. James Wilson, NAACP Health Chair, and also Vice President for Talbot House, Virginia Scott, Director of Nursing, and Roy Winston, our City of Cincinnati Fire Chief. Before we get started with your questions, I would like for each panelist just make some brief intro remarks. And let's start with Dr. Odell Owens.
Well, thank you for inviting me to be part of this such a great panel. My opening comments are simply, if you have the opportunity to get the vaccine, take it. There is a shortage. There is going to be such a rush to get it. And with the increasing deaths in California and across this country, it is imperative that you move quickly. So when it's your turn in line, don't pass it up.
All right, thank you so much. And I want to give a shout out because Tropikana is here joining us. Tropikana, did you want to say hi before we go on?
Good afternoon, Jan-Michele Kearney. How are you?
Hi, and Happy New Year. So good to see you.
Happy New Year as well. I'm so excited about the panel. I saw that you were introducing the rest of our guests.
Yes. Okay. So let's go with Dr. Melba Moore. A few intro remarks.
Good afternoon and Happy New Year to everyone. To Dr. Owens' point, I got my shot. I didn't have any side effects, and I want to give a huge shout out to my director of nursing because she gave me my shot. She helped me feel at ease. And I kept playing with her saying, it must be the placebo because I didn't have any side effects. But seriously, on a serious note, I took my shot. I'm part of driving the herd immunity. Come join me and be a part of that drive with me. Thank you.
All right, thank you. Okay, Dr. James Wilson.
Thank you, Councilmember Jan. I'm honored to be among this very esteemed list of panelists. And I too echo the idea that the vaccine is a vaccination that is definitely worth taking. I join with others who are in the fight to really build up this herd immunity. I think it's something that we all ought to take the time to understand the necessity of having this vaccine, understand the issues in our community and how we need to take this. And so I want to commend Dr. Moore and Virginia Scott for their team. As a health department, my work at Talbot House, you all did a super job in vaccinating hundreds of clients and staff. And so just kudos. I think it's certainly a huge impact on those lives and their families and for the larger community. So I'm ready for this conversation. Echo Dr. Owens, Dr. Moore, let's get it done. Let's put the work in. Let's make it happen.
I like that. Let's get it done. Okay, our Cincinnati Fire Chief, Roy Winston.
Thank you. It's good to be with everyone this afternoon, the panelists, as well as those that are listening in. Appreciate being a part of that. As the fire department, this year, like for the rest of us, it's been unlike any year that I've experienced in my 32 plus years with the fire department. Before, this COVID, the fire department was on the front lines just dealing with those in the community, but then the impact was felt greatly in the fire department when more and more of our members became COVID positive. So I've seen the effects not only within the department, but really within the community of what COVID can do, and really the tragic nature that it really provides with loved ones and those within the community. So for me, it's a privilege to be a part of this panel to speak about the vaccine. I received it from one of the fine nurses at the health department, probably about 9-10 days ago. The rest of the fire department received it a few days later. And so just like Dr. Moore, I've had no side effects. So I too, feel good about advocating that within the community as well.
That's fantastic. Okay, and then speaking of our nursing department, head of Cincinnati's nursing department, Virginia Scott.
Hello, Happy New Year, everyone.
Happy New Year.
And I am going to echo that we really need to look at what's going on with this virus and get excited about this vaccine. And as your nursing director for the city, the health department is here and we are ready to educate everyone. And we are going to talk about some other reasons why during this hour that everyone really needs to take this vaccine. So absolutely. Thank you.
All right, thank you so much. Okay, we already have questions coming in the Q&A, but I told Chief Winston I was going to ask him first. How is the fire department involved with all of this, with the vaccines?
Well, we were like that 1B, if you will, as far as those that receive it, since we are, recognized as healthcare workers. And so the fire department has over 800 employees. And so we were really trying to impress upon those employees the need to get that, because if they get it, we in turn, we're going out into the community more so than others, having that contact. So getting that herd immunity started with us could only be a plus, for us as well as the community. Keeping ourselves safe in turn would transfer back out into the community. PPE is such a big deal these days. We run through it constantly, but at the same time, just that vaccination provides just another level of protection, I think, that our members can have. And one of the things we've seen is it's not that patient contact where our members have come down with COVID. It's really what they do at home, what they're doing on their off days, but they're bringing that into the firehouse. And by having them vaccinated and being able to take advantage of really this privilege of getting vaccinated early is just definitely something we could do to safeguard the community even more so.
That's fantastic. You're saying every member of the fire department has been vaccinated now. At least they've gotten the first dose.
Yes, well, every member has had the opportunity. I think we're about 60%, because one of the reasons why some haven't, we've probably had over 200 individuals that have tested positive for COVID. And they said that if you've had it within 60 days, which is about 150 firefighters, they didn't advise you to get the vaccine then. So Dr. Moore and them had that dose for us down the line when they're outside of that 60-day window. So at this point, we're about 60%. We're still trying to put our arms around how many others, because some people either work on their off days, work in other professions where they could receive it, as well as those who are not able to get that. So, but right now our numbers are looking about 60% so far.
Okay, that's great, and everybody's doing fine. You look healthy, and so that's good news, right?
Yeah.
Okay.
Yeah.
All right, Tropikana has some questions for us.
Good afternoon to our esteemed panel. Here is a question from one of our participants. When will the vaccine be available for those who are not elderly, who are not in healthcare, and not well connected?
Good afternoon, and thank you for that question. As we all know, and if many don't know, the state of Ohio set guidance up for who would immediately receive the vaccine. And part of that guidance, it stipulated that under 1A, phase 1A, so it's going to be administered in phases. Under phase 1A, we had those healthcare workers who are on the front line actually interfacing with individuals who may be positive for COVID to get to receive the vaccine initially. And also in that group were our EMT, emergency medical transporters, the medical transporters who are transporting COVID patients, such as that are not connected to private ambulances. Those individuals are part of 1A. And I have a link to our website that I will share a little later that outlines all of 1A. And there are approximately 8 priority groups within 1A. And just to give you a sense of what that's looking like. So I told you it's hospital inpatient care, private medical transport, public health pod workers, those individuals who are going around now vaccinating, they're the ones that are covered initially, as well as what we did in our planning. We knew that we needed all hands on deck. So we're looking at our clinical operations as well, being a part of that public health workforce to get vaccinated. We knew that our EMTs, all of them are certified, so we needed to vaccinate them. And that's that group, Doc, that Chief Winston brought to you. The next group are the long-term care facilities who are not involved or connected with or signed up for the retail pharmacy program, that federal program that was put out there. We know that the governor has talked about 1B will be next, and that's individuals 65 and older, school personnel. That means adults that work with children, that are engaged and involved in those schools working with children. So those administrators, those teachers, the cafeteria workers. And I know people say, well, they're not in school, but nonetheless, what we know is after the winter break, those children might be, because that's the deal. We want to get kids back in school. So those individuals are going to be interfacing with our children. So we want them vaccinated and protected. And then we're waiting on our next guidance, which will probably come with 1C. We haven't gotten those guidance yet. So the question that was asked, as soon as that information becomes available, that information will be on our website, and I will share that with our partners in the community, as well as the Health Gap, as well as Dr. Owens that's out here on our panel, as well as our city council and our city leadership. So you know exactly when it's coming. We've already started having pre-conversations with our 1B group. And when I say our 1B group that we know of, that the governor has talked about, are those individuals 65 and older with those high health risks. And the school administrators, we've begun talking with Mr. Greg Johnson over at CMHA, because we want to go back to them. And I have to just pause for a minute and give a shout out. This summer, my clinical team was working to have pop-up testing. And I was talking with Renee Mahaffey-Harris over at the Health Gap. And we decided on this, first it was a 90-day plan. Then they said, come on, Commissioner, scale back. It was a 30-day plan. Then it was a 60-day plan. And what we learned in there, and I remember Ms. Scott saying this to me, she said, Commissioner, we got this down pat as long as we got those extra hands helping us, which was the National Guard. So for us, what we're doing, we're taking that framework of what we did there, looking at bringing in our strike force teams, and that would be what Ms. Scott's probably going to talk to you about, the teams that she has that can physically go in to these various facilities and get them vaccinated. The other approach to our planning is to provide the vaccine under our watchful eye, meaning that we will have someone on site, such as a Talbot House, to observe, to make sure everything is going according to plan, so that we do not become a part of that statistic that you've heard about where the vaccine set out too long. We even have a plan where at 12 o'clock in the afternoon, our providers are calling us and giving us a heads up to say, we either need more or we have more than what we need. And then that's when Ms. Scott's team gets ready to receive that vaccine about 3:30 in the afternoon, to then be able to call out to others that we've scheduled to come in to receive the vaccine. So we have a plan to push it out. We have a plan that brings it back, and that vaccine has to come back to us each and every day. So we have that plan in place, and we're working with others.
Okay, thank you, Dr. Moore. That's fantastic. Now, I just have to remind everybody, we've got a lot of questions that are coming up, so we might have to start going a little bit faster. Tropikana, but thank you. That's great information, and we really needed to hear that whole framework. Tropikana, you had a follow-up question.
I do. Listeners want to know, the news has been projecting a slower than expected rollout for the vaccine. How will this affect the community, herd immunity, and the fight against COVID?
Well, they're correct. Initially, the thought was that 20 million people will be vaccinated by the end of December, and that just hasn't worked out. There's only been about 12 million doses of the vaccine distributed across the country, and the latest data that I've seen says about 2.7 million people have actually gotten the vaccine. So that's going to certainly impact herd immunity. You know, you got to get a lot more people vaccinated. And this brings up for me the issue among African Americans that we should not be on the sidelines debating if we're going to get this. The narrative really should have been for African Americans, and the energy should have gone, and we should have been 1A. We should have been 1A because, as someone said earlier, we were 4 times as likely to get the disease and twice likely to die. So they were short on the vaccine from Pfizer, and initially they were going to hold like 500,000 vials in reserve, which made no sense. And then Medina came along, and that's going to help. There's going to be a third vaccine to probably be approved that's going to help with the supply. So it's going to be a slow process because even when it gets past the 1A and the 1Bs, individual physicians, at least in Ohio, will probably have to apply to become a provider. You just say, well, I'm a physician, I'm going to automatically get it. No, you're going to be registered to get it. So it's going to take a while. So the general public, I don't see the general public getting this until probably March, April, maybe into May.
Okay. And that,
so I don't see any type of herd immunity.
Okay. I think Robert Brown, that probably answered your question, but Robert was asking, given that minority communities have suffered disproportionately from this virus, which is what Dr. Owens was just saying, this community should be given preferential vaccine access, which it's not. And how do we plan to facilitate this? But it sounds like the plan is already rolled out.
Right. But you know, Jan, the thing is, when you raise that question to people in power, their answer is, well, African Americans will get it because they are considered essential workers. So we're going to see them because they're the people who are working in restaurants and in hospitals. So that's sort of their argument back, that you're going to be in that first group based on your occupation. But that doesn't cover the majority of us.
Okay. All right. So Robert, that's your answer. Probably not the answer you wanted to hear. But, you know, okay, so here's another question. It's from Pamela Juros-Frink, and she said, where do dialysis center workers fit into this vaccine schedule? They seem like they're healthcare workers. Are they in that phase 1A? Dr. Moore, you're actually muted. I'm sorry.
Yes.
There you go.
Yes,
okay.
They're within that because we talk about outpatient clinical services, and they would be in that 1A group. And that would be the group that we reach to either see if they have a clinical team on staff to vaccinate, or that's where we would send in one of our strike forces to.
Okay. All right.
Okay. We have a question from another listener. They want to know, does it matter which vaccine I receive?
No, I think they both are equal in their efficacy. Both average around 95%. My argument is get whoever one you can get it where you can get it.
Yeah, I remember Dr. Camille Jones said the vaccine that you get is the right one for you. You just need to get one. Now there are 3 of them now, right? So there's Pfizer, Moderna, and AstraZeneca. I understand. I don't know if AstraZeneca is over here in the States yet.
I don't know if it's been fully approved by the FDA yet.
Okay. All right, Dr. Moore,
but at least there are at least 6 different companies that the United States has made an investment in to get vaccines from once they get approved.
Okay. And then Eric wants to know, is there a marketing campaign educating people about the location and timing of the vaccine? I mean, the real question is, how do we know when it's our turn?
Right.
As I shared on our website, and 1B, 1A, and when 1B is uncovered last week in our conference calls with the state, the governor outlined 1B, and there are 3 categories there under 1B. Educators K through 12 and the adult population working with those children. 2 are individuals who have congenital disorders or conditions. And then those who are 65 and older. That's what we know right now for who would be receiving it under 1B.
So then Dr. Moore or anyone, so then what happens? Because, you know, in Florida, we saw people lined up standing up outside for 14 hours waiting to take it, I guess because they were old, 65 or older, or they were in one of those phases that Florida was vaccinating. But how do we know, like, are they going to call us? Are they going to email us and say, come on, or, you know, go to your nearest pharmacy? Where do we get it? How do we know it's our turn? But what's the process?
So our process right now is, and has been, that we're reaching out to those individual organizations like the Episcopal Retirement Group. We've reached out to them. We've reached out to CMHA. And we've also reached to our employee health services, because what we're saying in preparation for 1B, we know that those groups, and there are many more that we're reaching out to that have populations that fall into that group. We're meeting next week with the Cincinnati Public Schools to tier up how that will roll out. And again, it will more than likely be the process that we went through for the pop-up testing, such as I would reach out to the clergy through President Mahaffey Harris and say, let's get on that call again with that clergy group that we met with, and let's identify within their congregates who falls within that category. So now we got some information going to them. So each of our partners that we work with, we're gonna reach to them. That's our plan, until we have some supplemental conversations with some others for them to open up who they're actually seeing.
Okay.
And providing vaccines to.
Dr. Moore, you mentioned schools. Should we expect for the vaccination to be mandatory like the other vaccinations for our kids when we send them back to school?
Well, what we know under this vaccine, we're not making it mandatory, but what we're doing is strongly advising people to get the vaccine. So, you know, for an example, we know that hospitals require their staff that are in those hospital facilities to get a flu vaccine. Right. That's not necessarily universal across other clinical operations. And some it is and some it isn't. So with this vaccine, under this emergency order, we are not mandating that you receive it. We're just strongly advising that you need to take it when it becomes available, because we know what COVID will do. We know this is not
why it's not mandated to be, why it's not a mandatory vaccine if we know the damage that it does, and we also know that it has caused a global pandemic. Why are we not making it mandatory for the general public?
One reason, because it's too new, and they were concerned about the side effects. Okay. So, and you remember now, the government does have a fund to cover people that have a reaction and may require medical treatment, hospitalization from the vaccine. So one of the reasons they make it mandatory was, one, because of not understanding all the side effects yet. 2, politically, because you do have groups out there that don't believe in any type of vaccination. So they want to try to get this out as much as they could without little controversy. But until they know more, it won't be mandatory.
Dr. Owens, could you speak to some of the side effects that have been experienced or that have been brought to the knowledge of the general public?
Yeah, and one clip that I've seen, the first 275,000 people who got the vaccination, what had been reported, and again, I said report doesn't always mean that everything gets reported. There were only about 70 reports of side effects. The major side effects occurred probably just like in England in the first couple of days, people with very severe reaction to the vaccination, but these were also people that had a strong history of allergies to medications or reactions to medications. So based on that, I would say to individuals, and this is important now, that if you have that kind of reaction in your past, or you're a person who carries an EpiPen, you would not get your vaccination at CVS or Walgreens, and maybe not in a doctor's office. You want to get your vaccination in a place where there's medical treatment available if you have a severe reaction. And two, if you have a history of allergies, I would say you should delay getting your vaccination until more people get it, because this is a learning process.
Right.
And we need more people to get it. And then I think by maybe May or June, we can say, hey, these are the various categories of people who've demonstrated some sensitivity to the vaccine.
And this, Jenny, I'll also add that we received our vaccine on the 22nd. We are providing vaccines on the 22nd. And I can say I have been instrumental hands-on, and we had a few, but they were really mild, soreness at the injection site. A couple other things happened, but it's only been about 4 to 5. We have our communicable disease staff is watching those. And since the 22nd, I can say that we have not had any serious or severe reactions to the vaccine. And Dr. Moore, I think we probably provided at least 400 to 500 of our own. We done sent more than that outward as far as MOUs into other ancillary operations. However, what we have done as far as from the health department, we have not seen anything serious, just to let everyone know.
On a call that Dr. Moore and I were on last week, the report from Ohio was they have known about 2 cases.
Okay. All right, very encouraging. So people should not be afraid.
No.
That's 361 City of Cincinnati Health Department employees, 395 Fire Department employees, and 328 Talbot House. And Talbot House falls under 1A in that it is a congregate care setting.
Right. Okay. All right. So Kathy Bailey has a really good question here, and this is of grave concern. She said, I've seen some people that have posted that they received the first vaccine. I've noticed they aren't wearing their mask anymore in pictures now. Will there be PSAs for our community to let people know that they still need to wear masks? I'm concerned that these pictures are sending the wrong message. And Chief Winston, it sounds like you have something to say about this. Chief Winston, you're still.
That was our same thing. Our members are, they live in the firehouse 24 hours a day. And it's like, okay, now we don't need these masks that you're making us wear, but we try to help them to appreciate you only get that 95% of efficacy after the second dose. And we're used to it. We get hepatitis vaccine when we first get employed. You have to have multiple doses. So this is the same kind of process. You need the 2 doses. We wait 28 days for the Moderna, which is the one we received, in order to get our immunity built up like that. So no, that the mask wearing is still necessary in order to stop the spread.
All right, and so that brings up another question I see several coming up. Do we need 2 doses? So a lot of people are saying, is it just 1 and done, or do I have to get 2?
2.
Got to get 2. Okay. And they're spaced out, and they'll tell you because it really depends on which vaccine, right? Dr. Wilson, you're muted too.
Yeah, I was going to chime in on Chief Winston's comment about wearing the mask in our residential programs. Even though we had a number of staff and clients take the shot, we're still requiring staff to wear a mask in the building. And a comment Dr. Owens made is that the vaccine through the clinical testing has shown that it's 95% effective. So there's still a very small percentage of folks that still, even with the vaccine, still may get the disease. So we are strongly encouraging employees and clients to continue to wear the mask and practice all of the safe distancing and cleaning, the washing of the hands, cleaning of the surfaces, and all of the protocols from the CDC that have been issued for months now.
All right. Okay. Thank you. And then a similar question. Okay. So we get 2 shots this year. We get vaccinated. What about next year? Are we going to have to do this every year, or is it, a few years? How is this going to work?
Well, again, they need to gather as much information, because you're right. We're not clear if your immunity lasts 3 months, 6 months, or a year. The earlier part of, the middle part of last year, there were reported cases of people getting COVID twice, and people weren't sure. And then there's a couple of cases they actually proved that they probably got it twice, meaning the first time around that person didn't get the kind of immunity that they thought they would get. However, the good news is that the vaccine will give you a longer longevity of immunity than if you get it naturally. So it may become seasonal, and there's a possibility that and we don't know yet if these new strains can mutate, where they may need a different type of vaccine in the future.
Okay, all right.
We have a question from Veronica. She wants to know, for someone who carries an EPI pen or EpiPen, with Dr. Owens' recommendations, how would one get an appointment at a facility with the necessary medical equipment to address a potential anaphylactic reaction versus CVS, health department, et cetera?
Well, my answer would be that Dr. Moore has that ability and the power to designate some of her health centers as being a place for high-risk people to go and to get their injection, because they'll have a support teams there.
And I'll add here, at the health department at Burnett and King, I have a clinical staff that's monitoring you after 15 minutes. And if you show anything, I'm extending that for 30 minutes. And all my teams, they carry EpiPens. When we was over at Talbot House, my nurses had an EpiPen on them. So I started planning for that prior, as soon as this was coming on, because really Pfizer is the one who states that you must be monitored. But we went right in. I told Dr. Moore, my team will be monitoring. So I have a registered nurse that will monitor you after your injection, and she has your EpiPen. She will have her EpiPen on her.
Now,
you know what? I just love your attitude, Ms. Scott, because I'm like, okay, I would feel safe with you because you sound like you are just on top of this. Thank you so much.
Thank you. Thank you.
We have a question from Lisa. She said, thinking about the child care providers in our community, they are not in K through 12 settings, but working with young children daily. What are your suggestions for them?
Yeah, it's a good question.
Well, I'll speak. I chair the preschool promise. And so, we're providing education for, providing vouchers for kids to 3 and 4 years old to go to quality preschool. I think they should be included in a group of, with the teachers. So I think they should lobby that. And as chair of that group, we will make that recommendation, but they need to be protected as well.
Now, I have a question as a parent. Now, we are definitely talking about healthcare providers, and we talk about our elderly community and how important it is for them to receive the vaccination. But what about our kids with underlying symptoms? And everyone kind of knows I talk about Boogie often. My son was premature. He has congenital heart disease. Should he be considered as somebody that should be looking at getting a vaccine with that first group of people that are getting them? Should I be looking at getting him vaccinated?
Well, right now, they're not looking at people under the age of 16. Again, part of the study was looking at different subgroups, and the majority of these groups did not test young people, at least in the ones that are out there so far. So that'd be a little bit of a hesitant for someone very young to get it, unless Dr. Moore knows something new about this.
Dr. Moore?
So Moderna is 18. So 18 for Moderna and 5 versus 16.
So are they starting to test this on younger children and like pregnant women? I know there's certain groups like children and pregnant women who have been left out of the sample.
But they still have ongoing studies. The reason they were able to, normally this process is 3 years, and the reason it's 3 years is that you start with a smaller group, you go to a larger group, and then the big group. What they did was do a lot of these groups at the same time, and in fact, Johnson had to pause their study because they gave their elderly group the wrong dose. So they don't have enough information yet on the older group because they didn't give them the right dose to really get that type of immunity. So yes, there's probably right now, I'm sure some studies going on with people younger than that. They're just not at the point that they can make that recommendation.
Right. Okay. Oh, wow. This is, this is really complicated, but I still feel like we're making progress, even though, I'm thinking back to Dr. Owens, what you said about 2.7 million have been vaccinated, and we were promised 20 million people by the end of last year. So how's this going to roll out? Dr. Moore, I guess this is your question. How are we going to, make this happen now?
Well, I talked about, we have our 1A group that we're going through. We have an MOU that we enter into with each one of those entities, like the developmental disabled organizations. We're working with them. We have a listing of those that we have to address. We have a listing of home health agencies here in Cincinnati that we have to address. Those providers that you heard Dr. Owens mention, and dentists. We're working, we've identified at least one group right now that we're getting ready to get them lined up with this MOU so that they can approve it. And then we can give them the vaccine and have one of our staff there to monitor it, provide that oversight so they can administer to the staff. The process that moves really fast, that we're really trying to ramp up, is for our strike teams, because it's easy for us to just take the vaccine, go in and do it. But we have to have sufficient staffing for that. We've called up the medical reserve because we want to be able to utilize volunteers as well as other volunteers from our health department to assist us in this process, because we know it's going to take a lot of hands to get this done. But we have to be mindful that, as I said earlier, we've administered about 1,104 doses already, which leaves us with about 300 to cover what's remaining in the fire department, our medical transport, and then we have another 500 doses that's going to go out the door to a long-term care facility that's not staffed and part of that program. So if you have a long-term care facility with 300 people, there you go. 500 goes straight to them with 200 doses left over. Then we find another one. We know that we have several other behavioral health organizations that consider congregate care that we have to get this to.
Well,
so
are
right
we getting more coming in? Is there, are we getting more in? You're making me worried that maybe we don't have enough.
I don't want you to worry, but we knew early on, and we were told that the supply coming out would be a limited supply initially. We're looking at maybe in phase 3 or 4 where the supply would be more readily available. And with the new presidential team coming in, it might be even more vaccine to come in. Okay. So what we know is we're moving it as fast as we can to get it out and get it into the arms of people.
Okay, all right.
Jan, this thing is still so fluid that, the original plan was that the first 20 million doses, it was only going to take care of 10 million people. The initial plan was that you were going to be required to hold on to that second dose for that individual to come back in the 21 days or 28 days. Well, they quickly got rid of that in order to try to reach more people, hoping that a little bit of immunity is better than no immunity at all.
Okay, so
but that also brings up the big
shot. So one shot is better than none, but you really still need two. Right?
And to me, that's going to be the problem. Our second problem is getting people to come back for that second dose, because many people are going to think, I got one dose, I got enough. Not true.
Okay, you need to get two. Okay. Now, is there any cost for the vaccine? Is it free for everybody all the time?
Nothing's free. You are allowed to charge an administrative fee, but that's usually covered by your insurance or Medicaid, Medicare.
And what we do is, if someone shows, it's just like our pop-up testing, it was the same process. We're not going to refuse anyone. If you don't have the insurance, that's okay. You're going to get it. Okay. Just come. When it's your time, come.
Okay.
And let's get it.
Okay, that's great. Okay, now here's a question. Let's see, from one of our listeners. It says, the vaccine is to provide an immune response for the patient. Is that person or patient no longer a potential carrier and unable to transmit the virus to an unvaccinated person?
We don't know that yet.
We just don't know. But remember, also, there's a 5% failure rate. Dr. Wilson pointed that out, or Dr. Winston, Mr. Winston, Chief Winston. There's a 5% failure rate. So if you get the vaccine.
Oops.
Oh, no.
Dr. Owens, come on back. All right, he'll be back. All right.
Back on.
Okay.
So doesn't mean with the vaccine, you may be part of that 5%, which means you have no protection. So you still can get it, still can be a passer.
Okay, all right. So someone else is asking, should dialysis patients be vaccinated? And let me just throw in there, because someone else had asked about people who are currently undergoing chemotherapy. Are there certain groups that should not be vaccinated or maybe should wait? Tell us about those.
Well, I think you'd be very, very careful. There's a concept of antibody-dependent enhancement, meaning that some people who will get the vaccination, depending on their medical condition, the vaccine may turn on them and cause more conditions associated with inflammatory disease of the veins, these vasculitis that people get. So those are people that be very careful, need to have a conversation with their physician. But also, I think that's the group that you kind of wait down to May or June when you've had more information about how other people have responded.
Okay, all right.
I have a question from an anonymous attendee. She said, I'm in my 60s. Who do I call to get a vaccine? Do I just call my medical, her medical professional who she goes to, or does she need to call the health department to be issued a vaccination?
She's in her 60s, which means does she have other pre-existing medical conditions? Because if she does, then that might guide her to be in 1B, high risk in that category.
So she should reach
but
out.
She could call the health department. Yes, call the health department. Just call us. We can talk with her.
Our second question is, where does the supply come from? Does the state drive the dissemination to the county and the cities?
The vaccine that we're receiving is coming directly from Moderna.
Okay.
Okay, so here's a question for Dr. Wilson and the NAACP. Is there a plan to get the word out that people, because people are still afraid of the vaccine. I've heard people even, some folks in the medical field say, I'm afraid to get it. So is there a plan to let people know it's safe, you need to get it, it's life-saving? What is the NAACP's position or plan on that?
Sure, yeah. I think that's the challenge of this quick rollout of the vaccine is really taking some time to really communicate the necessity of taking the vaccine. The short answer is there is a plan to do more communication with the wider community, to advocate and to make people aware that this is the vaccine is available for those groups that Dr. Moore had mentioned. I also would add too that, in concert with the rollout of the vaccine, and I think any substantive conversation about why particularly Black people and people of color ought to take the vaccine, you have to also address a lot of the issues of mistrust that you mentioned. Certainly, there's a long history, a very pronounced history of mistreatment and abuse and things of that nature. And so I think having those types of transparent conversations for some people to really get past and beyond the trust issues. I think another issue that also I'd be interested in maybe Dr. Owens or Dr. Moore addressing is I'm also hearing that people may be pursuing more natural healthy options to booster their immunity as opposed to taking the shot. And so I think that's one of the reasons I hear why people might be against the vaccine is that they're opting for more natural options, boosting their immune system in a healthier, safer way, perhaps.
Is there any response to that, Dr. Moore or Dr. Owens? Because we want to boost our immune system for sure, but don't we still need to be vaccinated?
Oh, absolutely. There is no alternative to the vaccine. Now, again, people have looked at and they found that at least early on, there was some concern that people who had maybe low calcium may be more susceptible. People with a certain blood type might be. So a lot of things that are out there that certainly we need to see more study. But in terms of you having the ability to boost your immune system to that point that you don't need a vaccine and can take on the virus, that just isn't true.
How do we combat that though when we have those conversations? Because we have those very dedicated Dr. Sebi fans who believe that they can just take enough supplements or we can just be vegan, and being vegan will take anything out of our body. How do I combat that with a listener or someone who wants to have that information?
I'm gonna touch on this too, Dr. Owens.
Sure.
And I think we probably still need to address the elephant in the room a little bit. It is going back before the vaccine. And I just want to give y'all a little bit about what I experienced. I know Dr. Moore talked about, we looked at 30 days of testing. We went 21 weeks straight of testing. And one of those weeks, my son, I brought him up there because his girlfriend is a flight attendant. He came back positive, asymptomatic. And from March 2020 to today, January 2021, I have 11 family members that was affected with COVID. We buried my uncle week before Thanksgiving. 3 friends passed. Chronic conditions, back to African Americans. And I'm gonna tell you what my son, I said, I need to put this out here. I'm the nursing director for our entire city, and I couldn't even educate or try to influence you on certain tasks. He told me, Mom, don't say nothing. I don't want nobody to know. It still goes back to that. Before we can get them to take this vaccine, is we have to get back on that and tell the truth to each other and to friends and to, you know, because the more we put that out there, the friend that's just passed a couple weeks ago, uncontrolled diabetes, didn't tell anybody. We still need to get back to that piece on health disparities within our communities. Even with me, every single day from March, probably January, because I went to Commissioner Moore and said, I want the entire staff mass fit test in February. We've been on this, and I'm pushing everyday numbers and CDC, and you still getting the comments, Jenny, this isn't real, it's fake. So now we at the vaccine, but we still got to get back to that first piece before people can believe it. And we look at it, we lead in hypertension, we lead in cardiovascular. We've received the most complications in diabetes than any other race. And those are the ones that's not making it. So it's like, you need to get it, because if you get to the hospital, you might not make it because of your congestive heart failure that you're not taking care of, and your diabetes that you haven't went to the doctor. Did you go to the doctor? Do you even have a doctor? So I think we still got to keep pushing and educating the basics in our community, because I'm gonna tell you, it's cheaper and better to prevent it than it is to try to treat it. And especially when it comes to this. So I think we have to keep pushing that key before we can even talk to them about getting this vaccine, because I'm trying and I'm pushing it to everybody I know. If you see my Facebook page, you'll start laughing, but I'm trying to educate, but that's our key though, Tropikana.
But also very healthy teenagers, people in their 20s and 30s, very healthy, good immune systems, have gotten COVID and have died. So it just isn't that your immune system is low, because you said these are very healthy, in shape people, no underlying medical problems, have gotten it and have died. Everybody reacts to any disease differently.
Yeah, so that's a real good point. Anybody can get it, and people die of all ages, but I see what Ms. Scott's trying to tell us.
Oh, very important.
Yeah, we've got to look at the health disparity. Yeah, at the health
underlying issues first.
Yeah, let me. Here's another question. I know we're getting toward the end. I don't want to leave out some of our questions, but Kathy Bailey has another question. She said, Governor DeWine encouraged all Ohioans to get the vaccine when it's offered to you. He mentioned that he didn't know when they would get back around to you if you skip it the first time. So this can be a challenge for those that have allergies and want to wait a few more months to better understand the data. How can people with allergies skip for a good reason and then get considered later and not be turned away? Any again, for those?
I would just say that again, I think they're going to recognize these issues as we go forward. We're going to recognize these issues. So people that may turn it down the first time because they have severe allergies, hopefully by that time they may say, okay, as I said earlier, you can't get it at CVS or Walgreens, but you can come to a health center and get it and be monitored and be taken care of if you have a reaction. So you will have an alternative. You will have an alternative.
Okay, all right.
I know that some hospitals in this country have told their employees, if you don't get it when we come around, then you won't have a second chance and you may lose your job then.
Okay, all right. And here's a question from Beverly Latham. She said, what are we doing to get information or to disarm disinformation to the community so that we can get the vaccines from storage to the arm? And she said lots of nursing home employees don't want to take the vaccine. So what are we doing about that? Renee, I know mentioned a campaign. Renee, did you want to mention that again? I saw it in the chat. Or anybody?
Well, I will talk about it now. So Hamilton County actually asked the Health Gap to do a research study to really get people's perspectives on COVID. And so we learned some really alarming things. Not only are people who aren't physicians, people who are physicians who are still questioning what, taking the vaccine, but what we can do now is push out messages through all of our platforms. We had over 60 organizations participate in this research study. We had support groups where men and women were coming together and talking about, the other impacts. And so I think the caution and the caution that we are putting forth in this campaign, We Must Save Us, is that we have all these different phases happening at the same time. And so we must continue to educate each other. And, you know, as Director Scott said, and as Dr. Owens, Dr. Moore, everyone, Chief Winston, we are really the biggest proponents of information and knowledge. And the more informed we are, the more informed we can be to our peers, to our family members. We all know that trust is a big factor in why we question everything in the medical community. However, as we become more informed, we are more equipped and empowered to be able to educate one another, and we trust one another. And so the work that each of our organizations are doing becomes even more important for us to be able to get good information. The Cincinnati Medical Association has trained other physicians on just the whole vaccine process and understanding the components of trials. And so that as we become informed at every level, then each of us is more educated. And I can't mention enough, you know, the National Medical Association sent out a love letter to the Black community. And it was really about, you know, what we need to do for ourselves. I heard Director Scott mention health disparities. This isn't new for us. And I know Dr. Owens, in his work as a physician or a physician for women, you know, saw many of the disparities. And so the question for us is how we talk to each other and get good information. There's going to be always that other information that's happening out there, right? That the social media doctors are amok, right? Mm-hmm. But if we, all of us, do the little part of sharing information or raising questions, and I really applaud Hamilton County and our Hamilton County commissioners for supporting this research study with Xavier University that has enabled us to get some good information to help drive the campaign messaging that will continue on. And that means we all don't receive messages the same. And so that we must make sure that we figure out the right voices, the right platforms, the right mechanisms to disseminate information. I think someone asked, how are we going to know? Well, it is up to us and our own network of Black and brown people in this region to figure that out. And I think if we all come closer together and work together towards that, we will be able to do that in ways that we never have seen before. So We Must Save Us is the campaign, and it's We Must Save Us at every level.
Right. Yes. And Veronica H., thank you for your comments. She says, thank you all. She's saying this to all the panelists for this informative and awesome information. She said, I really wish more people would be a part of this life-saving information. So it's up to all of us and all of you listening to get the information out to make sure people understand, because this is life-saving. And then here's another question. Someone said, when will the majority of the U.S. or Ohio be vaccinated? Let's start with Ohio. Let's start with Cincinnati. So,
oh, that's a tough question.
What kind of time frame? I know you can't say exactly, but what are you thinking? We are so ready to be done.
I'm thinking through the summer.
Okay.
We're going to be vaccinating and having pods for the general public this summer. I really believe that. As I said, it's been 2 weeks and we've gone through the majority of what we have received. And it's taking time. We just want people to be ready. I appeal to Tropikana just as I did before when I was on here, because it was her platform we listened to about the testing, giving you information, and you got that word out. So I'm appealing to you based on what Ms. Scott has said, what Dr. Owens has said, what everybody has said on this call. Please share it with your generation, your network, because we're seeing, I looked at the data today, it's the 20 and 30-year-olds. I'm seeing them testing positive, and the push that we're going to be putting out there, continue the testing and continue the vaccinations, get us more vaccines so we can get it into more arms, but please have people ready to receive it.
Yes. Right. Okay. Tropikana, I know you had a question.
I did. And thank you, Dr. Moore. I will do my very best to make sure I pass this information out. And please understand that you guys always have access to whatever platform I'm on if you have to get a message out. We have a comment from Kathy B. Bailey. Governor DeWine encouraged all Ohioans to get the vaccine when it is offered to you. He mentioned that he didn't know when they would get back around to you if they skip it the first time. This can be a challenge for those who have allergies and want to wait a few more months to better understand the data. How can people with allergies skip for a good reason and then get considered later and not be turned away?
Okay,
and that goes,
but someone might want to add to that.
Yeah, that goes back to that point that Dr. Owens said, you know, watch the research, watch what we're doing, and then have an engagement, communications with your primary care provider. And then what we know, what I'm estimating, that we will still be vaccinating in the summer. And if your provider says you can get it then there will be open pods, points of distribution for the general public. The other thing that Dr. Owens did remind us about is that some employers are saying within those health settings, those systems, health systems, that they're telling their employees, we have it now, get it now. And if you don't get it now, you might not have an opportunity later. So that's something that each individual will have to consider based on where they work, and then have had that conversation with their medical provider to support why they can't get it at that particular time.
Yeah, you know what? As soon as somebody tells me I can get in line, I'm going to be there. I mean, I'll be there so fast. And so someone is asking, is there a certain vaccine we should take? So the three that we know about, I guess 2 have been approved here, Pfizer and Moderna. Is there a certain one that's better than the other? We've gotten that question a lot.
No, the research is saying they're about 94, 95% efficacy. What we know is in the long-term care facilities, Pfizer vaccine is being administered there. What we're receiving through the health department is the Moderna vaccine. And I'm sure that will change over time as others come online. But for right now, we're receiving the Moderna vaccine.
Okay, but either one is fine. It doesn't matter, right?
Yes.
Okay. All right.
Jan, can I ask you a question?
Sure.
Jan, we got a couple questions from Kathy Bailey. Is that Kathy Bailey of the Water Department?
You know, I'm thinking it is, Kathy. If you can post up something in the chat. I don't know.
We should recognize her. We should recognize her and her
Yes.
work of not cutting water off. You know, she was a proponent in delaying that. And that is so important for African Americans, that she has helped save them by delaying cutting off anybody's water because of COVID and lack of payment. So we got to recognize people like that. If you don't mind that.
Kathy,
She's on by Facebook, and hopefully she can put something.
Yes,
it is Kathy Bailey. We've just confirmed.
Okay, well, a big shout out to Kathy. She's awesome. She's head of Greater Cincinnati Water Works. She's an African-American woman. She is awesome. And Dr. Owens, thank you for recognizing her, because people, you know, are suffering and didn't have money to pay their water bills. And she said, we're keeping all the water turned on. We're not going to have people hurt during this pandemic. So Kathy, you are our hero. Thank you so much. We really appreciate it.
Yeah.
So she's fantastic. Okay, so we are getting close to the end. I want everyone to have a chance to make some quick closing remarks. Let's just go right down the line. Chief Winston, we're going to start with you.
Once again, just want to say thank you for being a part of the privilege to be a part of this panel. I thought I knew a lot about it before, but after about an hour, it's amazing how much more you can really take in. And just as all the panelists have really intimated, I want to just encourage everyone to do your research. Definitely weigh those options. But we know, what COVID has done to the community, and the vaccine definitely seems like a positive alternative so far. So continue to do your research, and so that you can make an informed decision for you and your family.
All right, thank you. And I just want to say real quickly, someone just had a real good question. Are patients provided with the info on which vaccine they received so that the second vaccine is consistent? And my understanding is you do have to take the same vaccine the second time. So yes. Ms. Scott is saying yes. Okay, so yes, you will take the second one. Okay, Ms. Scott, since we're on you, closing remarks.
Okay, I say take care of yourself. Someone talked about healthcare accountability of yourself. We want to do that. You want to also go talk to your doctor. Don't sit up here and say that we're not just going to take the vaccine. Talk to your provider. If you don't have one, we can get you one. And another one is call the health department with questions. Thank you.
All right, thank you. Dr. Wilson, you're next.
Yes, thank you. Again, thank you for the opportunity to share. I say ask questions, especially for those people who are skeptical, maybe, distrusting. I'd say do your homework, and I'd say trust the science, follow the direction of your medical provider, and let's all get engaged and let's all defeat this disease.
All right, thank you. Dr. Odell Owens.
Congressman Lewis used to say, if you see wrong, speak up. I say, if you hear wrong, speak up.
There you go.
Share good information with your friends and your family.
Absolutely. Thank you so much for your wisdom. Dr. Moore.
New year, new mindset. Get vaccinated. Thank you.
All right. Tropikana, my fantastic superstar co-moderator. I'll let you close us out and introduce Renee.
Thank you so much, Councilwoman Jan-Michele and Kearney, for all of your dedication to the city. You know I have to say your whole name. Thank you to our esteemed panel, Dr. Moore, Dr. Wilson, Dr. Owens, Ms. Scott. You guys are all amazing. And there is no other way I would rather kick my 2021 off with this information so I can go tell everybody the facts, because now I'm a genius, thanks to you guys. I have to say a very huge thank you to the Center for Closing the Health Gap for making this platform even possible. We could not do this at all if it was not for the brilliant mind of our CEO, Miss Renee Mahaffey Harris. Let's turn it over to her.
Well, first of all, I want to thank each of you. We are in this together. We continue to be. I know as I sit and listen to each of you today that I am encouraged and confident that we can save each other's lives. Take the vaccine, and don't forget the 3 W's. Wear your mask, watch your distance, and wash your hands, no matter if you had the vaccine or not. I think all of the panelists, I think our moderators, Councilmember Kearney, and our radio personality, Tropikana, each of your organizations make all of this possible. I specifically want to thank our partners in the COVID-19 communityresources.com that launched on March 23rd as a trusted vehicle of information to save our lives. Those are the African American Chamber of Commerce, Eric Kearney, the Urban League of Greater Cincinnati and Southwest Ohio, Eddie Cohen, Joe Mallory, the NAACP of Southwest Ohio, and Dr. Roosevelt Walker of the Cincinnati Medical Association, and Councilmember Jan-Michele Kearney. Thank you all. Happy New Year. In 2021, we are going to save our lives, and I thank each of you for joining us today. Join us next week for more information on the vaccine, what we should know, how we can get it, and how we can continue to spread the word of good information to help save our lives. Thank you all. Have a great rest of the weekend.
Thanks, everybody. Thanks,
panel.